Hello, I'm Senator Chuck Grassley of Iowa. Thanks again for joining me on YouTube's Senate Hub to continue the open dialogue on healthcare reform that we started last week when I asked for your suggestions. Now, I got a lot of feedback, and I want to respond to comments made by many of you in the YouTube community. Matt from Cedar Falls suggests that we look into frivolous lawsuits that contribute to high health care costs. I agree with you, Matt. Cutting down on frivolous lawsuits and runaway jury rewards will help cut costs. When doctors endlessly worry about how not to be sued for malpractice, they obviously end up practicing defensive medicine. So we need doctors to be guided by sound medicine, not by the dictates of trial lawyers looking for a quick jackpot. Next, I want to move to a suggestion from Cedar Rapids, Iowa, regarding drug company advertising campaigns. These ad campaigns can help inform consumers on what medications are available and what healthcare benefits they provide. Drug companies use these direct to consumer advertisements just like any other business trying to get the word out on their products. One thing I'm looking into is the relationship between pharmaceutical companies and doctors. Drug and device makers dole out millions of dollars to doctors through dinners, speaking engagements, and travel. I've introduced legislation this Congress that would let the sunshine in on these relationships by requiring drug and device makers to disclose any honoraria that they give to doctors, because the patient-doctor relationship is vital to our healthcare system, and patients shouldn't be in the dark about whether or not their doctors are getting money from drug and device makers. And last, Tom from Waterloo suggests hospitals that provide the highest quality of care should receive the most reimbursement. One of my goals in healthcare reform is to realign the payment incentives to reward quality and value rather than the volume of services provided. Congress took steps to focus incentives on quality care back in 2005, but a lot more needs to be done, and it should be part of healthcare reform this very year. It only makes sense then to reward healthcare providers who work hard to deliver the highest quality care. Today, more often than not, Medicare actually can penalize providers who provide higher quality care, and of course that makes just no sense. So thanks again to everyone who participated in this interactive program. As the debate moves forward on healthcare reform, we need your common sense input. So keep it coming and help keep open the lines of communication that our system of representative government so much depends on.